Morning, everybody. Thank you for the opportunity to talk to you about the avian pneumovirus experience with this virus and the disease that it causes. Talk about the virus and the disease. Avian metapneumovirus, it's a paramyxovirus, just like Newcastle, but it's a different genus. It's the genus Metapneumovirus. There are four subtypes of the disease, the A, B, C, and D. It was first described in turkeys in South Africa in the late 1970s, and the first outbreak in the US was in 1996 with subtype C virus in turkeys. The virus has a worldwide distribution, and wild birds are the reservoir. This is very important to know. As far as natural experimental hosts and mechanical carriers, there have been documented species for subtypes A and B, such as turkeys, chickens, pheasants, guinea fowl, ducks, ostriches, seagulls, and pigeons. For subtype C, turkeys, sparrows, ducks, geese, swallows, gulls, and starlings have been documented. This virus disease is highly contagious. And throughout the presentation, you will see some items in boldface. Some of these are to address some of the questions that you submitted to us ahead of our presentation. So it's highly contagious. It has in the US, it has lived up to this. The incidence of the disease correlates with the density of poultry. So more poultry, more chances for transmission and movement. The virus is difficult to isolate. Again, it's proven to do so in the United States. So there's active and ongoing attempts to isolate it. It's a The virus is present in the respiratory secretions and excretions from infected birds, where it's protected by organic material. As far as the virus susceptibility to chemical and physical agents, the virus survives drying for about a week, and it's stable at pH values between 3 and 9. Like other viruses, it can survive for extended periods under cool and moist environmental conditions. This is a very known fact about viruses, particularly respiratory viruses. We seem to have always seem to have more problems during the colder winter months. As far as survival in the litter, it can last for 3 days from between 68 and 77 degrees, but it can survive longer, 14 to 30 days at equal to less 46 degrees Fahrenheit. So again, cool, cold, moist, that helps the survival of the virus. In a lab setting, during experiments, it can survive 12 weeks at 39 degrees, but then only 5 hours at 122. The virus is susceptible to detergents and disinfectants. The common name of the disease in turkeys is rhinotracheitis, and in chickens, it's been described as and named swollen head syndrome. Like I mentioned before, it's highly contagious respiratory disease of turkeys and chickens. It targets the upper respiratory tract. In turkeys, the disease is usually seen between 3 and 12 weeks of age, causing cough, sinusitis, conjunctivitis, watery eyes. Common co-infections are Bordetella avium and ORT. Secondary infections, the most common is E. coli, but also you could have ORT as a secondary infection. In turkeys, it causes a very severe disease, and it can lead to mortality as high as 30%, sometimes actually higher than 30%. So it's very devastating in turkeys. In turkey hens, it can cause a decrease in egg production with poor shell quality, increased egg yolk peritonitis, and neurological signs, which we'll describe it later in the presentation. In chickens, usually we see the disease between 4 and 6 weeks of age. It has milder respiratory signs. It can cause sinusitis, watery eyes. Secondary infection, the most common, is E. coli, which leads to worse clinical signs and lesions. And the fact is that you would not have a swollen head without that secondary E. coli infection. So the name comes from the pneumovirus plus the E. coli. Okay. In hens, It can cause egg production drops, both in table egg layers and broiler breeders, and it causes also neurological signs. So, what accounts for the variation of clinical signs? I always like to describe the disease process with this diagram. Disease is the outcome of interactions between the host, the pathogen, and the environment. You change any of these three main components, and the outcome changes. In the case of pneumovirus infection, one thing that changes the clinical signs are these co-infections or secondary bacterial infections. During my discussions about the disease with colleagues, the topic of immunosuppression came up. So I did a literature search and I found this paper from 2002, where during trials they demonstrated the immunosuppressive effects of this virus. And what they documented is that pneumovirus infection inhibited T cell proliferation, but had no effect on antibody production. Now think about this. In the at the point of entry in the upper respiratory tract, you have T cell accumulation, let's say in the Hardira gland. That's the first line of defense. So if at that point of infection, it immunosuppresses that T cell response, this perhaps is what explains why we see everything being worse with pneumovirus infection as it relates to bacterial and other co-infections. It just makes things worse. As far as the pathogenicity of the avian metapneumovirus, is very difficult to assess. What we do know is that there's a direct correlation between avian metapneumovirus infection and colibacillosis related mortality. Again, the outcomes depend on the environment, management, co-infections, and secondary infections. Some of these infections include E. coli, that's the main secondary infection, but also we have documented ORT, Bordetella, Gallibacterium, and a pestifer, infectious coryza, it's another possibility, mycoplasma, infectious bronchitis, infectious laryngotracheitis, and lentogenic Newcastle disease. Again, swollen heads, neurological signs, and or mortality from this infection are due to bacterial secondary infections or co-infections. Let's talk about signs, lesions, and diagnostics. As far as signs and lesions, here I am trying to show you some of the textbook pictures that we have about the disease. Here on the left-hand side, we have turkeys, a young turkey with a swollen infraorbital sinus. This is reminiscent of a Bordetella infection. It's just that in this case, it's a worse presentation. Um, in the lower picture, we have an older turkey with a markedly swollen infraorbital sinus, orbit, uh, swelling around the eye. You have increased tear production with bubble formation at the corner of the eye. In this case, the most likely co-infection is MG. So again, this infection makes an MG infection worse. In the middle pictures, we have broilers. Here's a broiler with conjunctivitis with what we describe as an almond-shaped eye. You can see the redness in the conjunctiva. The differential diagnosis when we see this would be infectious laryngotracheitis. In this case, is due to pneumovirus. So we need to rule in and rule out other infections, co-infections. This is the classic swelling around the eye and the infraorbital sinus. And here we have some tears coming out of the affected eye. Eventually, of course, this is part of that swollen head syndrome that we have talked about. In breeders, in the upper right corner, we have a hen with neurological signs. This is opisthotonus, which we actually have seen during the present outbreak. And this is a case of ophoritis. This is inflammation of the ovary with fibrinous exudate on the ova. And of course, market congestion. Now let's look at some real cases from this outbreak. This was actually the first case that I diagnosed. These are broiler breeders, 50 weeks old, And at the time of my visit, they had been losing about 30 birds a day in this particular house. They had placed them on antibiotics, and the mortality had dropped in this house to about 15 birds a day. There was a house right next to it, totally unaffected, non-clinical, nothing to be seen. Um, and in the affected house, we had birds, depressed birds with swollen heads. We had birds with neurological signs, like this one in the middle with opisthotonus, and we had birds with torticollis. Um, these neurological signs are due particularly to an infection in the pneumatic bone of the cranium. It can also affect the middle ear, but most of what we see is basically an infection in the pneumatic bone. The picture on the top left is of normal pneumatic bone right around the cerebellum. This is spongy bone with air spaces that are connected to the air sacs. This is an adaptation for flight. In the lower right corner, we have an affected cranium which with exudate filling those cranial air spaces. So intracranial pressure and perhaps middle ear infection is what leads to these neurological signs. And here in the middle, I have a video for you to see an affected hen with opisthotonus. I collected samples from the unaffected house. The fact is that by the time you see all these clinical signs in broiler breeders, the virus is it's mostly gone. What you're seeing is the aftermath, the secondary bacterial effects. So I collected samples from the unaffected house, non-clinical birds, and guess what? They were all positive, and we had a relatively low CT of 25.3 for avian pneumovirus B, which is the virus that we had known to be in our eastern area of the United States, and actually what started the outbreak and awareness and our awareness of the disease. So we confirmed that it was the B subtype. My second case was in broilers. I examined a large group of broilers, anywhere from 37 to 57 days old, and the complaint was swollen heads. And here in the top left corner, we have a broiler with infraorbital sinus swelling. In the lower left picture, we have I cut right above the eye to show you the fibrinous exudate and edema right above the eye. That this is what causes the swollen heads. And here on the lower side, it's actually the conjunctiva, very swollen, very reddened. It actually contained fibrinous exudate, actually very reminiscent of infectious laryngotracheitis. But these birds were ILT negative. This is all due to the pneumovirus, the secondary infection, the swollen head syndrome. I had this broiler here in the picture in the middle that was very interesting. It did not have a swollen head, but it had severe cellulitis all along the neck, demonstrated by this yellow fibrinous exudate. This is very likely an infection that started in the clavicular air sacs, the cervical air sacs, the ones that run along the neck. The other thing that struck me was that all these birds that have swollen heads and even this infection in the neck, they have very clean air sacs. That's what I'm trying to show you here in the picture on the far right. The air sacs were very clean. So again, the infection, everything was concentrated in the upper respiratory tract. As far as laboratory findings, like I mentioned, we detected avian metapneumovirus subtype B in quite a few of the samples. We also conducted, I swabbed the birds for aerobic culture for bacteriology, and we isolated E. coli and Enterococcus cecorum from subcutaneous tissue, and also from some birds that had systemic lesions. So we had E. coli and Enterococcus cecorum as co-infections, secondary infections. Okay. In addition to that, we also approach this from a comprehensive respiratory disease surveillance. So we actually added some of our molecular tools for bacteria. These words were negative for Avibacterium, infectious coryza. They were positive for Gallibacterium. They were all positive for ORT. They were MG and MS negative. So in this case, we have pneumovirus subtype B with E. coli, Enterococcus, Gallibacterium, and ORT contributing to the clinical picture that we saw. This case here, it's in turkey breeders, 45 weeks old, and this is a severely affected breeder flock. Here on the picture on the far left, I'm showing you a hen with a markedly swollen eye, crusting exudate around the nostrils, crusting exudate around the eyes, and the other thing is this dirty um, brownish feathers on the shoulder. And this is one of the ways we can tell that there's respiratory disease or something in the head of the birds. They wipe their head on their shoulder feathers, and then you end up with dirt sticking to that exudate. So it's a hallmark of respiratory disease in birds, and thanks to their white plumage, we can actually see that sometimes before we see anything else. We notice anything else. But in this case, the bird had, all the lesions that we expect from the infection. In this top middle picture, this is oophoritis and air saculitis, a lot of exudate around the ova. Some of these birds have polycerositis. We have exudate around, a swollen liver with fibrinous exudate on the capsule and air saculitis. Also wanted to show you here on the far right that some of these turkeys have a fibrinous pleuropneumonia. So the infection had contributed to this, but in this case, this is all bacterial. As far as the diagnostics, these turkeys were strongly positive for avian metapneumovirus type B, PCR. And to add to that, this flock was actually MG positive, which makes all the outcomes um, as bad as they can be. Okay. And in addition to the E. coli, they also had erysipelas. So again, these birds had a really rough time with the infection and all the co-infections and secondary infections. As far as disease awareness, we do know that the outbreak started in the eastern part of the United States, primarily with subtype B. That's what I'm illustrating with this salmon coloring on the affected states. And it has spread along the East Coast and now making a turn towards the Midwest. And then we started documenting subtype A. The first detection was in California. And not too long after that, it was detected in the state of Texas. So now we have two subtypes affecting our poultry industry, our nation. And the at-risk population, it's the U.S. poultry population at this point. So we have naive birds, they're going to get exposed, they're going to get infected. The outcomes, again, are going to vary. But what we have seen in a very predictable fashion has been the respiratory disease and the swollen heads, neurological signs in both older turkeys and broiler breeders. Um, so the disease is doing what it does. It's just that now we have far and wide spread of the disease. I'm going to share with you the field experiences. This is the voice of the customers, what they're telling us about what their experiences with this outbreak. The turkey industry, this is a subtype B experience. The outbreak started in turkey breeders they say about 6 months ago, but perhaps earlier. In turkey breeders, hens are more affected than the toms. Perhaps this is because they're housed at a higher density. There's increased mortality and production drops. and they have seen the neurological signs. Okay. As far as commercial turkeys, the clinical signs are commonly seen after they move them to from the brooder to the grow house. Cumulative mortality, like I mentioned before, it can be maybe 30%, but in some cases a lot higher than that. So it's a very devastating disease in commercial turkeys. Then the mortality actually could peak inside of a 2 week period. So reach 30% inside of a 2 week period. So it's again very severe. Now, treating the secondary infections with oxytetracycline, penicillin, and or sulfurs has helped, and actually it helps to decrease the mortality. In the broiler industry, we have now documented subtypes A and B, multiple experience, but what I call repeating patterns. The clinical signs were first observed in the breeders, usually breeders older than 40 weeks old. And it was followed then by swollen heads in broilers. But again, broilers that were over 4 weeks. So they may notice signs and maybe an increase in mortality in older broilers. In broiler breeders, mortality, again, anywhere from 30 to 50 birds a day. Response to antibiotics. Most of their customers have treated with oxytetracycline. Mortality goes back to normal after 7 to 10 days while on treatment for the secondary bacterial infections. Production drops are between 4 and 5%. There are no visible shell quality issues, and egg production recovered in 2 to 3 weeks. Serology has been used to monitor flocks, and in one complex, all flocks tested older than 25 weeks old have been positive. Again, this is about detecting what the infection leaves behind, which is antibodies. The virus is going to be long gone, but serology can be a good epidemiological tool to show you how far and wide infection has spread in your particular company or complex. In one complex, serum collected before February was totally negative. No clinical signs in pullets. And so far, in some complexes, they have tested negative. But they're planning to do some retrospective testing of bank serum from pullets and breeders. As far as broilers, customers, their flocks experience late mortality, like I mentioned, from 40 to 60 days old, four birds per thousand a day. Cumulative mortality on the average runs 5% higher than normal, than expected. The prevalence in one state, two complexes, 18% of the farms affected in one complex, only 3% in the other in the other complex. On a farm basis, not all houses have clinical signs. And on a house basis, there's low prevalence of the swollen heads. Serology, clinical flocks are positive, but they also have high ORT serology titers. In the layer industry, we had some experiences too, and what they have shared with subtype B in an inline complex, decreased feed consumption across 9 out of 10 houses within a 3 to 5 day period. Production drop between 5 and 7%. Feed consumption and production recover in between 1 and 3 weeks post let's say the onset of disease. The secondary bacterial infections persist 9 weeks later, mostly E. coli and peritonitis. The disease in a case-free organic layer flock. They were housed in a broiler breeder style house. Multiple flocks affected, depressed birds, torticollis, no production issues, slight increase in mortality, 10 to 20 birds versus 1 to 3 birds a day. So let's put this in context and some of my take-home messages. The disease is highly contagious. It's living up to what the textbooks and other countries' experiences have been. All poultry in our country is at risk with subtypes A and B circulating in the U.S. The disease responds to antibiotic treatment because, again, what we see is mostly due to bacterial co-infections or secondary infections. We are helping customers with ongoing avian metapneumovirus diagnostics and surveillance via PCR, virus isolation attempts, and serology. And on prevention and control, my colleague, Dr. Guillermo Zavala, will cover some of these topics. And with that, I thank you and I conclude my presentation.